duo. Dynamic duo.
The toddler stage is one of the most important part of a child's life. It is a time when a baby starts to walk, talk, and explore the world around them. From ages 1 to 3, toddlers begin to show their personality and independence. They learn to play, movement, and interaction with people.
According to Pilitary 2014, the toddler stage, which covers ages 1 to 3 years old, is a period of growing independence and self-control. In Freud's psychosexual theory, toddlers are in the anal stage, where they are learning how to control their bowel and bladder functions, helping them develop a sense of accomplishment. Erickson's psychosocial stage for this period is autonomy versus shame and doubt, in which toddlers gain confidence as they learn to do things independently, such as walking, feeding, and making simple choices. Piaget's cognitive theory places toddlers in the transition from the sensory motor to the pre-operational stage, where they begin to use language, symbols, and imitation through their thinking remains egocentric. Lastly, according to Kohlberg's moral theory, toddlers are in the pre-conventional level, where their understanding of right and wrong is based on avoiding punishment and seeking awards and rewards. Overall, the developmental goal during this stage is the achievement of autonomy, self-control, and independence through exploration and positive guidance from caregivers.
Now, let's talk about the other related developmental areas for toddlers. First is physical development. At this stage, toddlers are improving their motor skills and coordination. They begin to walk, climb, and even stack blocks, all of which help them gain better balance and body control. Next is emotional development. Toddlers are also learning how to express their feelings in safe and acceptable ways. It's normal for them to have temper tantrums or seek comfort from their caregivers as they manage big emotions that they cannot control yet. Next is social development. Socially, toddlers start to interact more with others, especially through playing. They often engage in parallel playing, meaning they play side by side with other children, even if they are not directly playing with them.
Language development. During this period, their vocabulary expands rapidly. They begin to use simple terms, simple sentences, and understand more words. Activities like reading aloud, and talking frequently to help them stimulate the language growth. And next is moral development. Toddlers also start to understand simple rules and ideas of fairness. Parents and caregivers can support this by rewarding cooperation and explaining the reasons behind simple rules, using why statements that toddlers can understand. And next is safety needs. Finally, safety remains an important area of development. Since toddlers love to explore, they are at high risk for accidents. That's why it's crucial to maintain a child-proof environment and ensure close supervisions at all times. Overall, these developmental areas work together to help toddlers grow into healthy, expressive, and curious young children.
Now that we know that this stage is all about independence, and you'll often hear toddlers say, "I'll do it myself." As they start walking, talking, and exploring their world, everything becomes an adventure.
That's right. According to Pilitary, this stage falls under Erickson autonomy versus shame and doubt, where toddlers learn to control their bodies and make simple choices. It's a critical time for building self-confidence and independence. With proper support, they develop a sense of autonomy, but if restricted too much, they may feel shame and doubt in their abilities.
Their development at this stage is super fast, physically, mentally, and emotionally. Let's talk about their vital signs, which are slightly different from infants and adults. Their heart rate is around 80 to 130 beats per minute, their respiratory rate 20 to 30 breaths per minute, and their blood pressure averages 90 over 60 mmHg, and their temperature is about 37 degrees Celsius or 98.6 degree Fahrenheit.
During this stage, toddlers start to develop regular routines for eating, sleeping, and toileting, all part of their growing independence. Their language skills also improve rapidly. By age 3, they can have a vocabulary up to 200 to 300 words and start from forming short sentences.
When it comes to physical growth, toddlers usually gain about 1.4 to 2.3 kilograms per year and grow around 7.5 centimeters annually. Their motor skills also progress fast. They can walk, run, climb, jump, and start using their hands more skillfully, like feeding themselves, stacking blocks, or scribbling with crayons.
Of course, all that growth means they need good nutrition. Toddlers should eat balanced diet rich in protein, calcium, iron, and vitamins. This is also the stage where picky eater starts, so caregivers need patience. Offering small and healthy portions and encouraging self-feeding helps a lot.
Let's not forget playtime. For toddlers, play is how they learn. They usually engage in parallel play, meaning they play beside other children rather than directly with them. Great toys for this stage include stacking rings, picture books, push and pull toys, and building blocks, all of which help develop coordination and creativity.
Lastly, from a nursing and safety perspective, toddlers are naturally curious but still unaware of danger. So, caregivers and nurses should focus on safety, supervision, and positive reinforcement. This includes keeping the environment safe from choking hazard, sharp objects, and hot surfaces, because toddlers love to explore everything.
So to wrap it up, toddlers are little explorers learning how to be their own person, full of energy, curiosity, and personality. It is an exciting stage where they begin discovering what they can do with the guidance and support of the adults around them.
Now, let's talk about the exciting milestones children achieve as they grow, specifically in gross motor skills, fine motor skills, language, and play. Gross motor skills are all about the big movements like rolling, crawling, walking, and running. By around 12 months, most infants can stand with support, and by 18 months, they can walk independently. Toddlers continue to refine these skills and eventually jumping, climbing, and running smoothly.
Next, we have fine motor skills, the little precise movements we use to grasp objects, stack blocks, or hold a crayon. Around 6 months, infants starts rocking objects with their fingers, and by 12 months, they can pick up small objects using pincer grasps. Preschoolers improve further, learning to draw shapes, dress themselves, and use utensils properly. Language milestones are equally amazing. Babies start with cooing and babbling in the first months, say their first word around 12 months, and gradually combine words into a simple sentences by age 2. By preschool age, children can tell short stories, follow multiple steps, instructions, and ask questions to explore their world.
Finally, let's talk about play, because this is where learning and fun meet. Toddlers engage in parallel play and playing alongside other children. Toddlers enjoy cooperative play, sharing, and creating imaginative games. Play helps children develop social skills, creativity, and problem-solving abilities.
Every milestone, whether it's walking, talking, drawing, or sharing toys, is a step towards independence and learning. Observing these milestones helps caregivers support growth, encourage exploration, and ensure children are developing on track.
Hi everyone! Today I'll be talking about 3 common health concerns for toddlers and how can we care for them. You see, in the toddler stage, it is where the immune system and digestive system of the toddler are still developing, making them more prone to certain health issues. Today, I'll be talking 3 of them. First, we'll talk about respiratory infections, such as colds, pneumonia, and even bronchiolitis. You see, toddlers are more susceptible to common health issues like this because their immune system are still developing and they're exposed to germs much more easily. So, here are 3 care plans and with their nursing diagnosis. First, we have ineffective airway clearance. You see, this means that the toddler may have trouble breathing or clearing mucus. To help, we must monitor their breathing and oxygen levels, even encouraging fluids to thin out mucus, and teach caregivers gentle nasal suctioning. Second, we have risk for infection. This refers to the possibility of the illness getting worse or even spreading. We practice strict hygiene and isolate the child from another sick children or even such a child. Then, we must ensure that their vaccinations are up to date. Third, we have imbalanced nutrition. So, illness can obviously reduce appetite. So, this diagnosis focused on maintaining proper nutrition. We offer small and frequent meals and provide nutrient-rich food and fluids, and to monitor the toddler's weight and even hydration. Next, we have diaper dermatitis or diaper rash. You see, this happens because of moisture, irritation, or even infections. So, here are also 3 care plans that we can care for our toddlers. First, we have impaired skin integrity. This refers to the skin being damaged or irritated. And our care must include changing diapers frequently, applying barriers such as zinc oxide, and allowing the skin to air out from the diaper. Second, we have risk for infection. Because rash can be infected, we must gently clean the area, which we must watch for signs for infection such as redness or even pain, and teach caregivers proper diaper hygiene. Third, we have pain. Obviously, rash can cause discomfort, and we can use age-appropriate pain relief, distract toddler when changing the diaper, and use soft, breathable diapers to reduce friction. Lastly, we have gastrointestinal concerns or problems, such as diarrhea or constipation, which are common to toddlers. How so? Because again, their digestive system are still developing or immature, or even dietary changes of the toddler. So here are 3 care plans to the common problem. So first, we have risk for fluid volume deficit. This means that the toddler may become dehydrated, in which we must encourage rehydration solutions, monitor intake and output, and avoid sugary drinks that may worsen the diarrhea. Second, we have altered nutrition or less body requirements. Here, we focused on maintaining proper nutrition, because care must include small or frequent meals with easily digestible foods, and encouraging breastfeeding or formula, and monitoring the growth of the toddler. Third, we have risk for impaired skin integrity. So this means that for frequent tools, it can irritate the skin more. So we must clean the area gently, apply protective ointments, and use soft clothing or loose diapers.
In conclusion, understanding the growth and development of a toddler helps us provide age-appropriate care and meet the unique needs of the individual across the lifespan.
By applying theories of development and recognize small milestones, we can promote holistic well-being physically, emotionally, and socially.